So I just started watching those videos. I used to watch videos from my mobile phone only. So wherever I go, I will have my mobile phone with me. So I used to watch whenever I get a break. I used to watch the videos. I prepared notes of very few main topics only. I was not able to prepare the entire topics notes. So I prepared notes of cleft lip and palate topics, then graft flap, only relative the most common topics, then the laser and all, which we have to last minute. I have to go through all those values and all. So those topics I have prepared a small note. Then I will advise to keep a means repeatedly. We have to be thorough with the topics of graph.
Yeah, so revision is more important than reading most of the topics.
Yeah.
I mean, revision, at least for the common, I think common questions, revision is the key when the recall value is much better.
The in stage one, that means majority of it is because of Marrow only. I just solely dependent on the Marrow videos. For the second stage, actually, it includes a part of my experience from the first that exam I gave. So the knowledge that I gained from that has helped me. Then the faculties of our department of plastic surgery here are also very helpful, and they also means their guidance is also helpful for me.
Hi, everyone. So I'd like all of you to welcome Dr. Manju. So she's cracked the INI SS and she's got a combined merit list in plastic surgery of 8 and an AIIMS merit list of 4. And we really congratulate you, Dr. Manju, for this.
Thank you, ma'am. Thank you so much, ma'am.
So, we'd just like to know from you a few things for the candidates who are preparing for their super specialty entrance exams. So insights from the toppers always help the candidates who are preparing, and they always, want to ask some of the questions which are repetitive for all of them. They want to ask, so I'll be putting forward some questions to you, and let us know as to how the candidates can prepare, and it will make the things easy for them. So the first and foremost, what I would like to know is, how did you prepare? Like, what was your main, the material that you prepared from for the plastic surgery entrance?
Okay, that for preparation, I have mainly I depended on Marrow videos only, ma'am. Actually, I subscribed to Marrow last year during September time. At that time, I
All
was
right.
doing my final year post graduation MS in general surgery.
Right.
So I subscribed during September, but at that time I was busy that I was not able to go through the videos. Then
Right.
I gave my final exam during the January 2022. So at that time,
Okay.
the INA-SS
So yeah,
exam
we'd
was
just like to tell the people viewing this interview session that Dr. Manju has completed her MS in general surgery from AIIMS Raipur, and she's currently working as a senior resident there only. And you began your senior residency in March,
yes, ma'am, during
right?
March.
Yeah, and you finished your MS general surgery in January.
Yes, ma'am.
Okay, great. And so please carry on. So you subscribed to the Marrow last September, but of course, yeah, because of your final exams, I'm sure you did not get the time to go through the material then. So
Uh,
when did you actually start preparing, like for the entrance exam?
Actually, I started during that last October, November time only, ma'am, because
Oh,
my exam was during January, and at that time, I thought that I would give one either that NEET exam or INA-SS so that I would be familiar with what all questions will be asked in the next exam. So
right.
for that, I started watching the videos during this October, November, around that October, November time. For the NEET exam, I was like ineligible because the criteria was like those who finished their PG by November. So I thought I will give the
Right,
INASS
right.
exam. So I just started watching those videos. I used to watch videos from my mobile phone only. So wherever I go, I will have my mobile phone with me. So I used to watch
Right.
whenever I get a break. I used to watch the videos, go through the videos. But at that time, means I got means during my PG time, I had that posting in plastic surgery, but unfortunately, because of that COVID time, I got to see a few cases only. Not all that, so many cases I did not saw those cases during my PG time. So I
Right.
was familiar with graft and flap surgeries, but I
Hmm.
did not see the syndactyly cleft surgeries and all at that time. So from
Right.
your videos only, I got to know like these all topics come under plastic surgery. I have to learn about those things. Still,
Yeah.
then I was watching those videos for first time at that time. So some concepts were very new to me, and I'm hearing those for the first time.
First time.
So I just went to all those videos at that time, but still there was only limited time at that duration. So finally, I gave that INISS exam, and actually I got rank 40 at that time in the AIIMS
Okay.
merit list, and
Right.
common merit list it was 36.
Okay.
Uh, then after that, I got an idea how to prepare actually what all
Prepare.
things they ask for the examination.
Hmm. True.
Then came that my final year exam that I finished in January. And
Hmm.
after that, I thought of preparing well for the next INISS examination. But somehow, because of there was some delay, like I went to for that open counseling and all. After that, I came for interview, like some
Hmm.
delay happened that still after that uh, I managed to go through your videos. Then I prepared notes of very few main topics only. I was not
Hmm.
able to prepare the entire topics notes.
Hmm.
So
Notes.
I prepared notes of cleft lip and palate topics, then graft, flap, only relative the most common topics, then the laser and all, which we have to last minute. I have to go
Yeah.
through
Last
all
week.
those values and all.
Yeah.
So
Yeah.
those
Yeah.
topics I have prepared a small note. Then
Hmm.
rest I used to go through your videos only.
Okay. So, what was your textbook? I mean, which textbook did you refer to when you were preparing?
Actually, to be honest, I have read some part from the McGregor book. Grab and
Okay.
Smith, I opened in between. I just read a few topics only. Then
Hmm.
after that, I felt like to get a concise knowledge about
Hmm.
all the topics. Your videos are enough. And
Hmm.
there was also time shortage. So I thought I
Hmm.
will first means get an overview about all these topics. After that, I
Right.
will read the Grab and Smith. So
Yeah. Yeah.
mainly I read this McGregor book. Then
Hmm.
some parts of keynotes also I used to read.
Hmm. 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 Hmm.
And
So, I
apart
mean,
from
if you divide in percentage, like what percentage of your preparation would be Marrow and what percentage of your preparation would be like textbook based? So, how would you think that you divided?
around 65 percentage of my preparation is from Marrow only. Then around 20 percentage that will be from the textbooks or any other materials that I got sometime. Then the rest I means I got some knowledge while working in the department of
Working.
plastic
Yeah.
surgery.
Yeah, so that's what, like, this time when we were conducting the pre-interview session, the Zoom session, so, some people were genuinely worried whether working in a department, previous to your interview, does it help? So that's what I told the candidates that, yeah, it does help, but then it's not that freshers can't compete. It's almost like, some of them were thinking that, we don't stand a chance. But I think even in your MS, if you've had a basic rotation of plastic surgery, I think that is also okay to give you a basic idea about, how the things go on in plastic surgery. Now, another thing that I would want you to answer would be that in terms of division between the topics, like the general topics and the, like, the system specific topics. So, what do you think? How much time did you devote, or rather, if I can put the question the other way, so if you talk about the Marrow videos, how much time in a day did you actually give to the Marrow videos alone? And then, how much time did you give to the textbook? Was it a clear division that you had in mind, or you just went random?
I went randomly only, ma'am. I am not means. I when I gave that first exam, I thought like I got an idea what all books to be read, but
Right.
I was not able to follow that thing which I planned.
Right. Another thing I wanted to ask you was that in terms of like the stage one and stage two exam. So, do you think that did you appear for the stage two exam last time?
Yes, ma'am.
You did, right? And so, what do you think, like for a general overview, the pattern of the stage one exam and the pattern of stage two exam? Like, if you just like to brief the candidates about it, uh, as to how much should weightage should be given to general plastic surgery, then how much to systems, and then what exactly to focus on in the interview. If you can take us through that, please.
Okay, ma'am. So I gave the last INSS exam stage 1 and 2, and this time also I gave the exam. So from both the exams, what I felt was like around 30 questions were from general surgery part, and 50 questions were from plastic surgery in the stage 1. So
Right.
in those topics from the plastic surgery, um, actually it varies. Last time there were majority of questions were from means no topic can be left out. They will ask some question from every part. So this time they did not ask from any question from the cleft lip cleft palate topic. Last time they have asked, and this time they have means they touches all that means every topic.
Every
So,
topic.
but the videos are enough for answering all those questions. Then I will advise to keep a means repeatedly we have to be thorough with the topics of graph,
Yeah, so revision is
diagrams.
more important than reading most of the
Yes.
topics. I mean, yeah, revision, at least for the common, I think common questions, revision is the key when the recall value is much better of a
Yeah.
topic. And okay, tell us about the stage two, like the pattern of the stage two exam last time and this time.
Both time, the stage two is mainly based on the clinical things only. So there will be mostly the pattern is like they ask X-ray instrument, then clinical scenarios, then about basic details about whether we have what all cases we have seen, and
Hmm.
related to those topics they will ask. So clinical scenarios, or they will show some clinical scenarios, and they will ask questions regarding I to identify the condition or the disease, then how we will plan treatment for this patient ahead. That will be means clinically
So how
oriented
many
only.
questions did they ask you in the OSCE this time, the stage two exam?
This time, actually, the number of examiners were more, interviewers were more, so the number of questions were also more. Last
Okay,
time,
so can
if
you just recall about four or five questions and just let us know the general idea as to what was the stage two about?
stage two, last time also, this time that included this post-burn contracture patient scenario, then
Hmm.
syndactyly scenario, polydactyly scenario, like that, the common cases
Hmm.
that we usually see in the clinical practice.
Hmm. Okay. And what about the X-rays? Do you recall any X-ray that they showed you?
Last time I did not get any X-ray. This time they have showed that dentigerous cyst.
Yeah. So I was asking about the instruments. Sorry.
Instruments, both times I got that Humvee's knife only, ma'am.
Hmm. Yeah. So that means common ones only. They'll not ask you very, odd ones out usually,
No,
right?
ma'am. The most I mean common clinical scenarios, instruments.
Hmm. So how much do you think was Marrow instrumental in your selection between stage one and stage two both?
The in stage one, that means majority of it is because of Marrow only. I was solely dependent on the Marrow videos. For the second stage, actually, it includes a part of my experience from the first that exam I gave. So the knowledge that I gained from that has helped me. Then the faculties of our department of plastic surgery here are also very helpful, and they
Hmm.
also gives means their guidance is also helpful for me. Then the clinical exposure to
So, but
patients.
do you think that if somebody goes through the videos in detail, then most of the things have been covered in the videos?
Yes, ma'am. Most of the videos, means the videos include most of the common things, and it is the one good thing I noticed that it is concise and it is given in a simplified form. So it is helpful for us to means recall, but we have to just revise through these
Yeah.
topics.
So did you
Majority of
also take the test? Uh, did you also go
uh,
through the questions that we've discussed
actually
in the module?
yes, ma'am. Not all of them, but I used to watch all those means few of at least few of these
Okay.
videos, and they are helpful. Only while solving these MCQs, we get an idea of how to approach these questions. And also, I gave
Right.
that last one mock exam of from Marrow, and
Yeah.
I got some around 2 to 3 questions of final exam I was able to answer because I gave that final mock exam. That was also
Wonderful.
helpful.
Tell us about the last minute preparations that you did for stage one. What was your basic approach for stage one? I mean, with what mindset did you go? How much general surgery will you answer? I mean, everybody makes a little plan for themselves. So, I mean, what was your plan for stage one and your plan for stage two? Especially, I'm talking about the last, like, let's say 15 days before your stage one exam, and let's say 4 to 5 days before your stage two exam.
Okay, ma'am. For stage one, by that time I have at least means watched the videos at least once. So I was planning to revise through those topics which are more important, means more commonly seen clinical topics like the graft, flap, cleft, laser, because I have to recall that. Then
Yeah.
I repeatedly revised those topics only. This time, actually, for the final exam, I skipped that aesthetics part, but there were questions from those topics also.
Yeah.
So, means no topics to be skipped. If we have time, we should go through all these topics,
All
but stress should be given to the more common topics. Then
right.
for general surgery part, every time they will ask from trauma topics. So trauma should be very, means we have to be thorough in trauma topics. Then apart from that, last time they have asked topics from breast, thyroid, and endocrinology. But this
Okay.
time the pattern was a little bit different. Means majority of questions from trauma only.
Hmm.
So it was okay, but I planned to attend around 65 questions,
Hmm.
but finally I means while marking and unmarking, finally I marked 76 questions, but that was
Oh,
a
wonderful.
mistake. But that was a
Okay.
mistake. So
Mistake.
I means I could have means avoided a few negative questions.
Yeah.
So I
So
think
that
it will
means,
be
yeah.
better to careful, means cautious about the negative
Yeah. So
marks
guesswork
also.
should be minimum, right?
Okay,
Guesswork should be
because
minimum.
every mark is very important.
Yeah, yeah, true. And there's heavy negative marking also. So yeah, definitely,
Yeah,
I think guesswork, especially when the number of questions is not huge, then I think negatives, they play a very important role in your ranking or your selection. So I feel that when the number of questions are more, you can take some guesswork, but when the number of questions are limited, then I think guesswork becomes a little expensive in
yeah.
and then the negative marking is quite significant in that. Okay, so NEET SS is around the corner. What would you give your advice to the people who are just in the thick of preparation right now? Can you name,
All
let's say, okay, can you name, I would say, 10 topics that are absolutely important and they can't skip?
for the upcoming NEET exam, actually the pattern has changed from the previous time. So this will be a PG exit level exam. So one has to go through all the general surgery, all those topics they have learned during the PG. But still, for the plastic surgery portion, I think the graft flap topic, then nerve repair, nerve injury part, then
Cleft
syndactyly,
lip
that
palate.
congenital cleft lip palate, congenital anomalies part,
Hmm,
then
hmm, hmm. Right.
craniosynostosis.
Facial trauma also.
Trauma is very important.
Right. Hmm, hmm.
Then
Burns.
burns is one topic that one can never miss in plastic
You never
surgery.
miss.
Then aesthetics, that liposuction, basic things in aesthetics
Basic.
part.
Right, right. So, just last few questions to you. Uh, what did you, I mean, why did you choose plastic surgery as your specialty? What made you choose that?
Actually, my interest in plastic surgery, I got to know when during my PG when I got the plastic surgery posting, and our faculties over here are so good that I got an inspiration from them also. That is one factor. Then other factor is like I was interested in geometry, anatomy during my school days and then MBBS time. So I think in plastic surgery, all these topics are we find a way to use all these things in plastic surgery,
Yeah,
and
right.
simply I get my happiness
So
while
it
working
was
in
clear
plastic
in your
surgery.
mind that you want to become a plastic. I mean, in the super specialist, this you want to become a plastic surgeon. There was no confusion in your mind as to
No,
regarding
ma'am,
the
by
choice
the
of
end
branch.
of third year I was not having any confusion regarding that.
That's wonderful. So, which college are you planning to join?
That question, to answer it, I means I need some more time, ma'am. I have to
Right.
discuss with some seniors and
Yeah.
think about that.
Yeah, sure. So again, plastic surgery is such a wide specialty, as I've discussed this last time also in the interview. uh, it's such a wide specialty that once you enter the specialty, you will feel that nothing is left out. We are doing everything from head to toe, right from hair transplant to ingrowing toenail to reconstructions, aesthetics, trauma, burns. It's such a huge specialty that ultimately, once you pass, you feel that it's difficult to practice the entire spectrum of that specialty. And ultimately, a lot of people end up choosing a subspecialty in the super specialty. It's the same with other super specialties also, I'm sure, because the level at which now the subspecialties are there, that also requires another that's another journey altogether to be lived. So I'm sure you're looking forward to your journey as a plastic surgeon. And
Yes, ma'am.
yeah, so again, i I think just last few tips from you. What do you think is the adequate time duration to prepare if one is looking forward to prepare from the basis of Marrow videos? So what do you think is the adequate time duration, and how much time one should mandatorily keep for revision? These are the two questions that I would like to answer.
I think around 2 to 3 months are enough for preparation on basis of this Marrow videos. If one is consistently watching these videos and preparing whatever method they are following. Some people like to prepare their own notes. Some like to watch the videos. So, and revision is very important part. So means how many times you are revising, that will help in registering these topics better and understanding each time. When we are revising the topic, we will get to understand some new concept of the same thing that we watched last time, but at that time I was not able to understand that. But next time
Understood.
so around I think 2 to 3 revisions will be should be done, will be adequate, and around some 20-15 days will be adequate for revision.
Okay, so you think that if one is consistent and devoting good amount of time, so you think 3 to 4 months are good to prepare.
Yes, ma'am.
Okay, that would be really, like, very encouraging for people who want to prepare. It will be very encouraging for them to hear, because again, like, one does need to, of course, devote time consistently, I think, and that's the most important thing. Even for people who are in their final year, also, if they're able to consistently devote, I think, 3-4 hours per day also, and they are doing it for 7 to 8 months, I think that would also be sufficient if they are doing it consistently. That's most
Yes,
important, I
ma'am.
think.
Now it is better that these platforms are available. I subscribed the Marrow when it started during this beginning time. If it was there, I would have subscribed it earlier.
So, did you also take their previous courses, like for the MS entrance and all?
MS entrance, actually, I took one course, ma'am, but that was I used to give the Marrow test series at that time.
Test series, okay, that you gave, okay, okay. So definitely, I think, ready, once the information is ready made available, it's much easier to utilize it, because in our days, I remember reading Grabs and Smith, highlighting, underlining, and then going back page by page. So obviously it's time consuming, and revision is also not very easy from the textbooks. And
Yes, ma'am.
yeah. So where do you think we could improve? You've gone through the module, and what do you think could be improved in our module?
Actually, it is given in a very nice way that we can adjust the speed of the videos. Then, right now, that timeline is also given of the topics. Previously, when it was started, it was not there, so it was a
Yeah.
little bit difficult. Then, I used to use other videos of Marrow also for my PG preparation, means PG final examination, Rohan sir's video, and I
Hmm.
also used to go through the other GI surgery, onco surgery, uro during
Right.
my PG preparation. So that Rohan sir's video have that notes also attached to it. So for
Right.
final last moment revision, it was very helpful.
Helpful.
So that is one thing. If the notes, at least important topics that to be recollected, like the laser values tables or something like
Hmm.
that, is given in a note format, then it will be better.
Better.
Otherwise, also it is very helpful and it's given in a very nice way. Actually, I'm very thankful to you, ma'am, that you are making our work lesser, and everything is given in the books, and they are asking from the books only. But to
Yeah.
read all those things, it takes much more time.
It does
So
take. Yeah.
making it easier, for
So
that,
I'm
I'm
glad
very
that
thankful to you.
yeah. So see, I'm thank you for the appreciation. It see actually, that's what my aim when I was preparing the lectures was, that I have to make it lucid for people to understand, because whatever is given in the textbook, of course you can read and understand, but many times interpretation of that becomes difficult, and especially for a person who's new to the subject. So I think that's what I was aiming to do through my lectures, was just to make it as simple as possible. And I don't know, I mean, you will tell me if I've made it simple enough or not.
Yes, ma'am, definitely. And I like that part also. You have means given the calculation of that lignocaine dose, which will be useful for me in my future also.
Yeah, yeah,
So I
that's
am planning whatever time I am getting now, I am planning to prepare a note of your videos so that I can use it in that those in future also. And you have given it very nicely. You have simplified the topics, given everything in a concise way. Everything is there, but in a concise way that is required for this entrance preparation.
yeah. So of course, I mean, it's almost, I mean, 50 hours plus videos that we've recorded, but still, the topics are huge. There's such a lot of so many topics to cover, that I still feel that I could have done better. But thank you so much, Manju, for talking to us, and welcome to the specialty. And we are glad to have you. Also, thank you for appreciating the module of Marrow SS, and we are hopeful that many candidates will benefit from what you've given as tips and tricks to the candidates. And I think consistency is the key. That is what I would like to. I mean, I think your take-home message is also the same. That consistency does pay off, and we have to revise. We have to go back to the same topics, and also, of course, try to cover as much as possible. Right?
Yes, ma'am. Thank you for this opportunity. And
Thank you so
so
much.
happy to be here. Thank you, ma'am.
Yeah, all right. All the best, and do well. Thank you.
Thank you, ma'am.